Hello, future nurses. Welcome back. My name is Jasmine, and I'm a nurse here at UWorld. Today, we're going to be doing an antepartum question drill. So we're going to cover all things antepartum. We're going to see things like fetal heart rate tracing, medications, and preterm labor. So if you've never joined us before for a question drill, this is what you can expect. I'm going to read the question, and then you guys have 30 seconds to answer. You can drop your answers in the chat. We have Nurse Rebecca here ready to answer all your questions. And then we're going to talk through why the correct answer is correct and why the wrong answers are wrong or distracting. Alrighty, I see a couple of you guys joining us already. We want to remind you to share this session, the more the merrier. Make sure you drop your comments in the chat and then follow us. We're trying to reach 100K on TikTok. We're pretty close and we're excited for that. All right, let's get started. Our first question says, the nurse in the labor and delivery unit is reviewing fetal heart rate patterns for multiple clients. Which of the following patterns would be a priority to follow up? Option 1, moderate variability with no accelerations. Option 2, minimal variability with a baseline rate of 115 minutes after receiving Zolpidem or Ambien. Option 3, minimal variability with recurrent late decelerations. And option 4, moderate variability with the baseline of 155 beats per minute after receiving penicillin. So let me know what you guys think. This one is a pretty tough one, but you guys got this. Alrighty. Let's see, we got, nice. It's your first time, welcome. This is a good time to practice. You know, you're not getting a grade on this. This is just for fun. We're here for you. We want you to learn what we're talking about. Give you guys a couple more minutes. Also, let us know where you guys are joining us from and which social media platform you're joining us from. We have TikTok, Facebook, YouTube, what else? Instagram. So we're everywhere. Alrighty, so we're gonna jump to the right answer. Alrighty, so the correct answer is going to be option 3, but there's a couple of terms that we should go over so we can fully understand the question and why the incorrect answers are incorrect. So we'll start with variability. That is the fluctuation of the fetal heart rate. It can be moderate, minimal, marked, or absent. And then we have accelerations. These are increases in fetal heart rate, and this is considered a reassuring sign. In clients who are over 32 weeks of gestation, an acceleration is 15 beats over the baseline of the fetal heart rate, and it should sustain for 15 seconds. And then in clients under 32 weeks gestation, an acceleration would be 10 beats per minute above the baseline, and it sustains for 10 seconds. So you may hear this as a 15 by 15 or 10 by 10. And then we'll jump into late decelerations. What does that mean? So these begin after the contraction starts, and it's typically at the lowest point of the deceleration after the peak of the contraction. And late decelerations are not a reassuring sign. This is a sign of uteral placental insufficiency. So this means that the baby is not getting enough oxygen, and this is where we want to worry. And then there's more, guys. The fetal heart rate tracings are divided into three categories. Category 1 is reassuring, and then there's category 2, which is everything in between, and then there's category 3, which is non-reassuring, and that's where we worry. So option 1 is a category 1 strip. We are not concerned about this baby right now. No accelerations just means like a fetal sleep cycle. Option 2, Zolpidem or Ambien, as you guys may know it. This is a sedative hypnotic that helps the mom sleep. So this is often given to our laboring mothers in early stages of labor, maybe to help for inductions and to help them sleep. And technically, this is a category 2 strip due to the minimal variability, but the fetal heart rate is 115, which is still in that normal range between 110 and 160. So we're going to keep an eye on this baby to see if it perks back up, but they're not our immediate priority. So that leaves option 3 as our correct answer. We have minimal variability is non-reassuring. So late decelerations, like I said earlier, it's a sign of uteral placental insufficiency when our baby is not getting enough oxygen, making that our correct answer. And then option 4 is a category 1 strip. Moderate variability is good. 155 is still in that normal range. And penicillin is commonly given to mothers who are GBS positive or carriers for the group B strep. So this doesn't pose much of a threat to the fully developed fetus, to the fully developed healthy mom, of course, but it could for the newborn. So we're going to give them prophylactic antibiotics. All right, let me get into here, see where you guys are joining us from. I see Ghana, Florida, Mexico. We have Los Angeles. Great job. You guys got all of that. You did awesome. I'm not a mother baby nurse, so you guys will teach me, we'll learn together. All right, next question, guys. The nurse is assessing a client with suspected placental abruption. Which of the following findings would support a diagnosis of placental abruption? Option 1, painless, bright red vaginal bleeding. Option 2, rigid, board-like abdomen. Option 3, referred shoulder pain. And option 4, uterine atony. Let us know what you guys think. I see Jordan, Kenya, Philippines, Connecticut, Canada. Nice. Thank you for joining us. Has anybody passed their NCLEX recently? Let us know if you're testing soon. We want to send you all the good vibes, all the good energy. We want you to pass, and we're so happy that you're here. Alrighty, so we'll jump to the correct answer. So our correct answer is option 2. With placental abruption, this is the separation of the placenta from the uterus. So the symptoms are going to vary depending on the severity of the abruption. It can be partial or it can be complete. Option 1, you will often see vaginal bleeding with placental abruption, and it's typically not painless. Other symptoms of the placental abruption include uterine tenderness and abdominal pain rather than that painless bleeding. Option 2 is our correct answer, right? Board-like abdomen is the hallmark sign of placental abruption. And if you were there yesterday during Samantha's lecture, you would have learned this because I learned that too. And then option 3, referred shoulder pain can be a sign of ruptured ectopic pregnancy. It also could be a sign of gas pain. It is not a sign of abruption. Option 4, we have uterine hypertonicity would be the clinical manifestation of abruption that we're looking for, but not atony, which means the lack of muscle tone, right? Good job. Ooh, somebody's getting ready to test soon. Annalise, good luck to you. You got this. You're in the right place. Let's see. We got someone joining us from Jamaica. Board-like, it means rigid. Just what it is. It means like a board-like. You see a board and it's rigid. That's what it means. Alrighty, let's move on to the next question, guys. Question 3. The nurse is reviewing new prescriptions for a client who is scheduled for induction of labor. The client has a history of previous cesarean birth and a positive test result for group B streptococcus, or GBS. Which of the following prescriptions should the nurse clarify? Option 1, oxytocin. Option 2, ampicillin. Option 3, misoprostol. And option 4, nalbuphine hydrochloride. Let us know what you guys think. And then I want to remind you guys to like, share, follow us, and I'll talk to you a little bit about our uworldnursing.com. This is where you can see everything that we're working on as far as a social media team. You can see our schedules, where we go live. You can learn more about our products. You can see the prices and the packages that we have available. You can see samples of questions, and then you can also sign up for our 7-day free trial, and you'll get 50 questions to practice. And then you can also see, which is my favorite, we have a 6-month NCLEX study plan, and there's other study plans that you have. So if you're really coming into the NCLEX new and you don't know what to do, this would be a great starting point just to even see the information that is going to be asked, and a great way to see a study plan as well. Okay, I see a bunch of correct answers already. So the NCLEX is for registered nurses and PNs, not for CNA, as far as I know. Alrighty. Great question, though. Okay, so the right answer is going to be option 3. Before we start, I'll tell you guys what VBAC means. It's vaginal birth after C-section. The client is wanting to have a vaginal birth after previously having a C-section. So option 1, previous C-section clients will still receive oxytocin or Pitocin. This is used to augment labor. It's not contraindicated with clients that have had a previous C-section. Option 2, ampicillin is an antibiotic that may be prescribed for GBS penicillin, and clindamycin are also another alternative. So that leaves option 3, our right answer, right? What is misoprostol? It's a cervical ripening agent. It helps stimulate contractions to help dilate and efface the cervix. The trade name is Satotec, if you've heard that one. So misoprostol is contraindicated in clients with past C-sections due to the risk of uterine rupture. So this is where we're going to be like, wait, we can't give this medication. We're going to clarify this. And then option 4, this is a synthetic opioid that works as analgesic. So it's also given for post C-section to help with itching that can result from some of the medications. So that leaves option 3 our correct answer. All right, you guys are doing awesome. So happy that you guys are here. Next question. The nurse is planning care for a client who is pregnant and has severe preeclampsia. Which of the following interventions should the nurse include in the client's plan of care? Select all the apply. Option 1, administer labetalol. Option 2, administered carboprost. Option 3, check deep tendon reflexes. Option 4, administer mag sulfate. And option 5, minimize environmental stimuli. So take your time with this one. We're going to have multiple correct answers, and you can approach this as a true or false approach with each option. All right. I'm looking at all your comments here. You guys are sending in your answers. Great job. Remember, this is the best time to practice. All right. All right. And then just another reminder again to tell you guys to visit uworldnursing.com. You can also sign up for question of the week. So this is where you'll get a question in your email and you'll get a chance to answer it, and you'll see our explanations, which is our selling point. We really love explaining everything to nursing students. We want to know that you know the information, not that you're just memorizing it. Remember, because the NCLEX is testing your critical thinking. And then we also have other stuff in there. We have illustrations, animations, tables, we have lectures. We have everything that you need if you're a different type of learner, like a visual learner, or if you learn from illustrations, you know, videos, whatever works for you. Let us know what works for you. Do we do bow tie questions? We do in our product. However, for the lives, we only do select all the apply and the other ones as far as time. But we also do concept maps, which Samantha does, and those are really great to look at. Alrighty, guys, so let's jump to the answer. Alrighty, so what do we know about severe preeclampsia? We know that it's a hypertensive disorder of pregnancy with the element of protein in the urine, right? So option 1 is correct. We want to give labetalol. It's a beta blocker that is safe to use during pregnancy, and it's used to decrease the blood pressure. Option 2 is incorrect. Carboprost is given to help the uterus contract after delivery. If there is excessive bleeding, this is not given in an antepartum setting. Remember, we're doing antepartum questions. And then option 3 is correct. We want to check deep tendon reflexes, often in a preeclampsia patient. In a client with a magnesium sulfate drip, they're checked hourly. So hyperreflexivity is an indicator of potential seizure. And then on the opposite side, depressed reflexes are a sign of magnesium toxicity. Option 4 is going to be correct. Like we just said, magnesium sulfate drip is a common treatment for severe preeclampsia. In severe cases, the clients will be induced or delivered via C-section, and they'll actually maintain that magnesium sulfate for 24 hours after delivery. And option 5 is going to be correct. We want to minimize environmental stimuli to help prevent seizure activity. Great job. Let's see, any questions? Jen Smith, this is going to be your question. It says only give labetalol if there are sustained severe range blood pressures. Every hospital is going to have different instructions, or every facility that you work, so you're going to follow what their protocol says. Great question. All right, so we're on question 4 out of 7. We're almost there, guys. If you're just joining us, let us know what you think the right answers are. and then we're going to judge you. No, I'm just kidding. We're going to explain everything, and then we hope that you understand the meaning behind the question. Our next question says, the nurse has taught a client who is entering the 3rd trimester of pregnancy. Which of the following statements would indicate a correct understanding of the teaching? Select all the apply. Option 1, fetal movement is expected to decrease toward the end of pregnancy. Option 2, lightning makes it easier to breathe but can cause increased bladder pressure. Option 3, spontaneous rupture of membranes can cause a large gush or slow trickle of fluid. Option 4, true labor occurs when regular contractions cause progressive dilation of the cervix. And option 5, blurry vision and a severe headache are common discomforts of pregnancy. So what do you know about the 3rd trimester of pregnancy? Let's see. I'm reading your comments. Great job, guys. Let us know what you like to do, what other topics you like to see, how you like to study. Do you like watching lectures? If you're already using UWorld, let us know what your favorite part is of UWorld. And then this is where we'll teach you guys the Spanish word of the day. So it's going to be trimester. In Spanish is trimestre. So trimester, trimestre. Now, I try to choose words that are relatively similar, so it's not too out there for you guys, but now you'll know. All right, so I see you guys dropped a bunch of answers already. We'll jump to the right answer. Alrighty, so we'll go through these options, right? Option 1 is incorrect. Fetal movement should not decrease. This would be a cause of concern. It's not an expected finding. So this would be a reflection of incorrect understanding of the teaching. Option 2 is going to be a correct answer. Lightning is when the fetus begins to drop down into the pelvis. They're getting ready for birth. So this may make it easier for the mother to breathe because the pressure is moving lower, but as the baby moves slower, it's going to cause more pressure on the bladder. And then option 3 is correct. Rupture can be large or small. This is true. So this reflects a correct understanding of the teaching. Okay, I see you guys are answering before I'm even answering, so great job. Let's see, option 4 is correct. True labor, this is the definition of it. The cervix needs to be making change in order for it to be a labor and not the Braxton Hicks contractions or false labor. And then option 5 is incorrect. We already talked about hypertension. A blurry vision and a headache are signs of high blood pressure. So this is potential gestational hypertension or preeclampsia, which is a cause of concern because they need treatment right away. Great job. All right, our next question. The nurse is screening clients for those at risk for experiencing preterm birth. The nurse should recognize that the client at highest risk for preterm birth is a client who, option 1, stopped smoking cigarettes 5 years ago. Option 2, had a previous vaginal birth at 38 weeks gestation. Option 3, has a pre-pregnancy BMI of 25 and a single gestation pregnancy. And option 4, started receiving prenatal care in the 3rd trimester and has bacterial vaginosis. Let us know what you guys think. Drink some water. All right, Hannah on YouTube, she says she likes listening to lectures. Yes, we do have partial credit on NCLEX. Great job. So, and then let me know which topics you like the best and which are your least favorite. Some people really like pediatrics. Some people really like mother baby, med surg, critical care. There's all kinds of options for you there. All right, so you guys are putting in midwifery. Perfect. That's not a common one to see. Oh, that is your least favorite. Okay. No, wait, that was someone else. I like critical care. Perfect. Maternity. All right. Growth and development is my least. To tell you the truth, that was my least favorite too. There was just so many ranges and so many milestones. I'm like, what? But we did it, right? We got to it. Alrighty, so the right answer is going to be option 4, right? What do we know about preterm birth? So a couple of risk factors are history of a previous preterm birth, infection of the genitals or reproductive system, that is that UTI or the bacterial vaginosis or an STI. We have multiple gestations, twins, triplets, they're at risk for preterm labor, cigarette smoking, and late initiation of prenatal care. So knowing all of this, we can determine that our correct answer is option 4. Option 1 is incorrect. Although smoking cigarettes is a risk factor, this client stopped 5 years ago, so they don't smoke currently. They're okay. Option 2, 38 weeks gestation is still considered a term birth. Preterm birth is anything after 37 weeks. I'm sorry. Full term is anything after 37 weeks. And then option 3, a BMI of 25 is in the normal range. This is considered healthy, so this is not a risk. And multiple gestations is a preterm labor risk factor. This client only had 1 gestation. So that leaves option 4 being our correct answer. All right. Somebody loves maternity. Somebody loves mid-surge. I hate all chapters. No, don't say that. Farm is our least favorite, but it's the most important. Remember. All right, you guys did awesome with those. Okay, let's move on to our last question. The nurse is reviewing new medication prescriptions for a client at 29 weeks gestation who is experiencing preterm labor. The nurse should clarify the prescription for 1, mag sulfate, option 2, cycline. Let me know what you guys think. Let me know how many you got right of the 7. And don't forget to like, share, and subscribe, like I said. And then do visit us at uworldnursing.com. You can subscribe. That way you don't miss anything that we're doing. And then we do go live also several times a week. And these are all central times. We go live Tuesdays at 12 with Nurse Samantha, Wednesdays at 11 and 7 a.m. and p.m., Thursdays at 11 a.m. and 3 p.m. and Fridays and Sundays at 7 p.m. with Nurse Andrew. So in case you guys are in school during the day, if you want to join after, you can. And these videos are also posted on our timelines wherever you like to watch, and you can see them. All right. You guys are answering fast. All right, I already see a couple of rationales there. You guys are doing amazing. Alrighty, so let's go through the options with these, right? Option 1, we already talked about mag-sulf, and it's safe to give in pregnancy. It's indicated for preterm labor as it works as a depressant acting on the central nervous system. It relaxes smooth muscle, most importantly, that uterine smooth muscle. From earlier that we said, we also know that it's indicated for seizure prophylactics in clients with preeclampsia. Option 2, betamethasone, is a steroid that actually helps the fetal lungs to develop. So typically this is given in 2 doses, 24-hour apart if time allows, and it's given via an injection. Option 3, indomethacin, is an NSAID that prevents prostaglandin production. This actually helps relax the smooth muscle of the uterus. So this is indicated for preterm labor, and it's safe to give in pregnancy under 32 weeks. And then that leaves option 4 being our correct answer. And I saw you guys drop that teratogen in the explanations, which is great job. Doxycycline is a tetracycline, which is a teratogen. So we wouldn't give this to a pregnant client at any gestational age. This can cause birth defects. An example would be like browning, staining of the fetal teeth, and impairs the development of fetal long bones. So this is one medication that we would avoid in this case. So that's it, guys. Let us know what you guys got right. Like I said, don't forget to like, share, and subscribe. And I'll leave you with this message. You have what it takes to be a safe and compassionate nurse, and we are here to support you. We want good nurses out there. We want everyone caring for each other, and we are here for you.